Well, welcome back. We are speaking with our Medicare and health insurance experts, Catherine CVA from AARP, Steve Edmonds from Alliance Insurance Services. We are taking your questions. You can see that there's a number at the bottom of your screen for you to ask things. Okay, so Steve, this person says, can I switch a Medigap plan for a different Medigap plan?
Possibly, and that's a little complicated, but when you're choosing a Medigap plan, the only time that you get a free pass, guaranteed issue, is when you're turning 65. At that point in time, the insurance carrier has to accept you, okay? So if you're talking about, okay, now I'm 3 or 4 years past age 65 and I found another Medigap plan maybe with a better price structure, sure, you possibly can switch, but it's going to be subject to medical underwriting. That means you're going to have to answer health questions, and according to your health status, will dictate whether or not another carrier might accept you or not.
Okay, gotcha. Catherine, this person's asking, other than Social Security, is there any other monthly assistance given for groceries or rent?
So there are some assistances. They're not actually tied to Medicare per se. If you're low income, you can get premium assistance from Medicare, but you can also look at the SNAP program, which is the Supplemental Nutrition Program for aging people. And it's a government plan, and they give you some funding each month to help you with your groceries.
Gotcha. Okay. Steve, this person's asking, what if I'm already on Medicare disability? Do I still need to sign up for Medicare when I'm 65?
So that's a little bit of a multi-layer question there. So the technical answer is no. You're already on Medicare, and you probably already have a Medicare plan. But most people that go on Medicare due to disability, they will end up taking a Medicare Advantage plan for their insurance coverage because it's a zero cost to it. But when you get 65, it gives you an open door opportunity to get a Medigap plan. So why not check when you turn 65 to see if that's not possibly going to be a better fit for you where you have better coverage? So my answer would be yes. I would probably check with my insurance person at least when I turn 65 to see if I can get a better plan or an upgraded plan.
Okay. Catherine, this person says, I've received my card already and I turned 65 in July. Do I need to do anything else?
No, you don't need to do anything else other than the next time you go into your doctor's office for an appointment, be sure you'll take it with you. And Medicare has changed their number, so it's no longer your Social Security number. You have a unique Medicare number, so you do need to hang on to that card and put it in your phone if you have an iPhone or a way to store that information, because you may be asked for a new number.
Well, thank goodness they're not using the Social Security number anymore, right?
That's right, they're not.
All right, but with that said, if someone calls you and says, hey, I'm calling from Medicare and I might be able to help you with such and such, what's your Medicare number? Steve, should anybody be giving out their Medicare number?
I would not do that. I mean, that's never a good idea. Usually, if you have questions that you need answers for, you can do the research. There's a state organization called SHIP. You can get information from them. You can go to insurance agents like myself, are always glad to help you answer Medicare questions. But I wouldn't be giving that stuff out over the telephone. I mean, you really don't know who you're talking to. It's never a good idea.
Gotcha. Okay. This is an interesting question. Maybe both of you need to answer this. Catherine, I'll start with you. If I'm planning on retiring, but in a different country, do I need to sign up for Medicare?
If you're planning to retire in another country, Medicare does not necessarily cover you out of the United States. So you need to be thinking about how to get that insurance. There is one exception. If you're retired military, TRICARE does cover you if you live out of the United States, but not Medicare.
Okay. This person says, Steve, I don't remember if I deferred Part B or not. I am still working. I signed up with a person on the phone. How do I find out if I deferred Part B?
Well, you would probably, if you had Part B, you would be paying a premium of $174.70 a month. So they would be deducting that from your Social Security check if you're drawing a Social Security check. If you're not drawing a Social Security check, they would be billing you directly in the mail per quarter for that 174.70. So that's one thing. I mean, are you paying a premium or not? The other way is just to pick up the phone and call Social Security Administration and ask them, is my Part B active or not?
And then you
Yeah.
can activate it if it's not. And
That's-
okay,
yeah.
gotcha.
Yeah.
All right, we're going to take a quick break. We're going to check in with the forecast. We'll be back with one more segment in just a minute.